posture here. This is part of our ongoing series of how to open up your posture, release tight muscles through your shoulder blades, and really increase the oxygenation to your body. So we're going to use our yoga therapy balls because we're going to start to work on those pesky mid-back muscles that everyone holds so much tension in. You're going to use these out of the bag, and what I want you to do is I want you to find a place where you can actually have a lot of room to move. You're going to end up with these balls right here in between your shoulder blades. So whether you kind of go from it like this or go from the top, whichever way you want to do it, but ultimately you want to end up with these right in your midline. If they're in your midline, they're not going to be going into your shoulder blades. They're going to be in that space between your spine and your shoulder blades. So go ahead and put the balls together and lie back. I'm actually going to do them from this direction. I find it a little bit easier. And once you get into this position, you kind of have to play with them, push them down a little, and usually you're going to have to move your body up a couple inches. Sometimes you have to move them. Okay, perfect. So it's kind of awkward when you're in this position, and there's only one thing you need to be aware of. You need to breathe. Otherwise, you're going to have a hard time releasing muscles. I want you to tuck your chin a little bit so you're not creating a lot of strain on your neck. So once you're in between the shoulder blade, and for some people, this is going to be tender as it is. What you're going to try and do is you're going to take your arms down both sides, and I want you to start to raise them up over your head and back down. Breathing as you go. And as you're doing this, you're moving the muscle over top of the balls, and it starts to break down a lot of the adhesions. Now, I do this often, so I'm making it look like it's not overly tender, but for a lot of people, this is the first time they've ever moved their body this way. You could hear some snaps and some pops and things like that. A lot of times it's just the tendons and so on snapping over the balls. It shouldn't hurt other than the fact that you're creating tension in the muscle. Okay? So I want you to do this maybe for 10 to 15 times. You can also do it alternate arms. Breathing in and out with each time you move. Okay? After you've done that for a while, I want you to bring your arms up overhead. And I want you to reach up, and then I want you to contract back. I want you to bring your arms up like you're holding onto a basketball, and then I want you to bring your arms down, and you're squeezing the balls with your shoulder blades. Up and contract. Again, 10 to 15 times when you do this. When you're done that, then I want you to go out to the side, reach right around and give yourself a big hug, and bring back out again. Ooh, little sore there, and back out. And back around. Ah, and back in. And you'll find that as you're moving it in different directions, you're going to want to naturally avoid the places that are most tender, and I'm going to tell you, sink into it, because that's where you need to go, baby. That's it. Okay? Squeeze, and back again. Okay? The other thing that you can do, and I want you to roll your shoulders down onto the back, so that the back of your hands are here. And you want to bring them forward like this, and back like that. Breathing as you go. And again, I'm not going to do it for 10 to 15 reps, but these are the type of movements that are going to start to move it. If you want to go into another position, put your feet underneath your knees, and I want you to bridge up a little bit. Okay? And then you can continue on. For some people, this is too much, but for other people, it gets in there nice and tight. Okay? Again, breathe, relax your jaw, and just start to move around. All right? So, that's the yoga therapy balls for your mid-back area. On our next version, I'll show you how to release a little bit higher up into your trap muscles. But that's it for now.